Hi, friends. This is your friend in health, Dr. Sandeep Jassal from livelifemore.com, and I am a preventive health consultant by specialization. And today, in this video, we are going to talk about one topic, and that is how soon and how safely we can start exercising again after recovering from COVID. Well, I have myself recovered recently from COVID. I got tested positive on January 4th, and today it is, when I'm recording this video, it is the evening or night of January 18th, 2022. So, this was one thing which I wanted to highlight because so many of our patients all around the globe who have been suffering from COVID and they are asking this question, and I thought this is very relevant question that they shouldn't overdo the exercise because what is happening is that there is one term which is labeled as long haul COVID. And now the long haul COVID is a term being used for a collection of symptoms which persist for so long after the COVID is over. So, chronic fatigue syndrome, which is feeling tired for a long time and you're chronically uh, feeling lack of energy, loss of initiative in you, and you feel low energy levels. So all these symptoms are the symptoms which hint that you might be suffering from chronic fatigue syndrome post recovery of COVID-19. So no matter which variant you have been going through, you have gone through, and no matter whom you know who has undergone COVID, if you like this information, then just hit the share button and do comment so that this good quality information can reach people. Now, this information is based upon one study which was published in Australia, and it was supervised, and it was the study was conducted under Dr. Keish, and it was proven that people who indulge in high intensity exercise soon after recovering COVID, getting motivated that yes, they will take better care of their health, and there is no wealth which is more precious than health. When we get such kind of a jolt on our health, wherein we have to self isolate ourselves, and we've got plenty of time isolating ourselves for 5 days, 7 days, sitting inside the four walls of our room, self isolating ourselves from the rest of the world, then of course our priority suddenly shifts from other things to our health because we are thinking only about ourselves when we are alone. Of course, we get motivated as soon as I'm out of this COVID, I'm going to start working upon my health. And some people may become over enthusiastic in starting their exercise regime. Of course, nutrition is very important, but exercise regime, if you start high intensity exercise too very soon, then that may sometimes be retroproductive for you because your body has not conditioned itself. You know that the COVID, in many cases, in 10 to 30% of the people, the symptoms of COVID, it has been found that can persist as long as from weeks to months after they have recovered. So if you don't recognize those symptoms, if you don't know what harm this virus might have done inside your blood vessels, inside your respiratory system, then sometimes it may be retroproductive if you indulge too very soon in too heavy an exercise like running on the treadmill or running outside, or doing high intensity exercise like strength training, which makes you so much breathless. So try to go slow on these kinds of exercises so that your body gets time to condition itself. The heart or the cardiovascular system, the heart muscle also gets enough time to condition itself that yes, you are now increasing the workload upon the heart, and gradually increasing the workload upon the respiratory system, the lungs, the lining of the lungs, which has been really affected by this virus. And you know that you have been coughing for some days and you are feeling breathless. That may be because of the reduced cardiorespiratory efficiency of your system. So you need to first condition yourself, do some pilate, do some yoga, do some pranayama, do some breathing exercise, do some stretching, mobilize yourself first, and then start some low intensity exercises in phases, in incremental format. That today you've climbed one step and tomorrow you'll be on next step, and then next day you will be like this. So if you can divide that in weekly pattern, that this week I'm going to do this much, and the next week I'm going to do this much, and the next week I'm going to do this much, then this can be a safer approach. And this is how you can safely start your exercise regime after recovering from COVID. So that's it. That's what I wanted to say. I hope this information would be very, very useful to you or to the people whom you know who are going through this disease. And I know there's a huge percentage of people who are now, right now, affected by this wave of COVID, that is the Omicron, or the previous wave that was Delta. Although the symptoms are not very, very serious, but still people will have symptoms and they will have to self isolate. They will have to practice all the precautionary measures so that they don't infect other people, and this disease gets curbed here without any other wave which can further trouble our mankind. So, friends, without taking much of your time, I'm taking leave for now from you. If you like this information, do hit the like button, do give your comment, and do give your feedback in the form of a comment, or do share it with other people who might find this information useful. So, this is your friend in health, Dr. Sandeep Jassal, signing off for now. Till we meet again, stay blessed and live life more. And thanks for watching. Bye bye.
अपनी जिंदगी में जोड़िए कई वर्ष और जिंदगी जोड़िए उन कई वर्षों में लिव लाइफ मोर लिव योर लाइफ मोर लिव लाइफ मोर लिव योर लाइफ मोर